We are presenting our newly developed machine learning solution designed to support automatic decision-making in our passive cortical speech mapping system, used by neurosurgeons to minimize the post-operative deficits associated with language perception and speech production. Neurosurgery for aggressive brain tumors and epilepsy involves resecting brain regions to extend life and achieve seizure freedom. Individual cortical functional mapping is crucial as it facilitates the preservation of critical brain areas, helping to maintain quality of post-surgery life. To ensure the retention of verbal communication abilities, a specialized procedure known as language cortex mapping is necessary. This step is crucial because the location of speech-related zones varies significantly among individuals. Language cortex mapping is conducted during surgery with the patient awake, performing a picture naming task. The patient's cortex is electrically stimulated to induce characteristic speech errors, allowing for the identification of speech-related areas. This procedure remains the gold standard for functional mapping in neurosurgery. Stimulation-based language cortex mapping in epilepsy surgery has significant drawbacks. It triggers intraoperative seizures in about 30% of cases and faces variability in effectiveness due to individual excitation threshold differences and subjectivity of assessment, leading to potential false negatives and positives. Additionally, it requires the presence of native-speaking neuromedical professional for accurate monitoring and is heavily dependent on the surgeon's skill with this technique. Recently, an alternative speech mapping procedure has been developed. Instead of stimulating the patient, a grid of electrodes is used to register the patient's brain activity during a language-related task. Patient's job remains the same, but no stimulation is performed. This approach addresses many shortcomings of stimulation-based methods. Nonetheless, it is still an experimental procedure due to the complexity of interpreting task-related activation signals from the electrode grid. The challenge is to identify channels that reflect speech-related activity to protect these cortical areas during resection. We have developed an electrocorticographic mapping system that uses a supervised machine learning model to analyze recorded data. Our system uses passively observed gamma band activity and predicts the results of the stimulation-based ESM without actually performing it. We also estimate the likelihood and confidence of each channel's involvement in speech processes. Our system also features real-time speech recording, which permits system to discard non-informative epochs and align informative ones based on speech onset. To train the model, we collected data from 14 patients with pharmacoresistant epilepsy with implanted ECOG strips in the dominant cerebral hemisphere. Overall, we collected data from 323 channels and over 1,566 valid trials. The evaluation of our model was conducted using a leave one subject out cross-validation method, where the model was trained on data from all subjects except one and then tested on the excluded subject. Among tested models, XGBoost classifier produces the highest ROC-AUC and PC-AUC scores of 0.846 and 0.8 respectively. For the threshold 0.3, the average sensitivity is over 85% and specificity is over 80%. As an example, we are showing results for a single patient. Our model uses features X to predict a score ranging between 0 and 1. To enhance model calibration, we employed Platt's method using a sigmoid regressor. We assessed uncertainty in these scores through a bootstrap procedure, where the box represents 50% and 95% confidence intervals. Our AI-driven electrocorticographic mapping system, currently undergoing clinical evaluation, utilizes simple models for clear interpretability with limited data. As more data become available, our scalable solution continues to be tested in awake brain surgery and with patients on invasive EEG monitoring. To our knowledge, this is the first system to use AI to identify language-related cortical areas in a stimulation-free manner. Thank you.